So without further ado, we'll get started. Please welcome our panel. I'm going to let everyone introduce themselves from here that way.
Sounds good. Good evening, everybody. My name is Annemarie Miller, and I am the director of the Early Childhood Programs with Rochester Community Schools. I oversee all of our pre-K tuition options for 3- and 4-year-old students, as well as Michigan's Pre-K for All GSRP programs.
Good evening. My name is Andrea Berry, and I also work for Rochester Schools. I am a school social worker, and most of my career has been working in preschool special education and elementary level. And I guess caregiving-wise, I also am a caregiver for 2 children who are 19 and 20, soon to be 23. And caregiving-wise, I also have experience of being a single parent for a portion of my life and bringing up 2 children on my own, and have that experience as well on a personal level.
Good evening. My name is Adam Hamilton. I am the clinical director at Oakland Community Health Network, and we are the community mental health for Oakland County. So my role there, I work closely with our network of contracted providers who provide supports to individuals with intellectual developmental disabilities, severe and persistent mental illness, serious emotional disturbance. We do lots of different things to support that provider network. And we try to get out in the community and engage with people as much as possible, because the focus of our role is really to be close to the community, understand the needs of the community, and be able to work with our provider network to kind of meet the community where it's at and where its needs are. So thanks for having me here tonight.
I'm Beth Hella, and I'm a public health nurse with Oakland County Health Division, which is now Oakland County Health and Human Services. I've been with the county for the last 31 years, and for the past 15 years, I work for a program called Children's Special Healthcare Services Program. And it's a program that assists families with children and young adults with special healthcare needs. I'm just out of curiosity, has anyone heard of Children's Special Healthcare or familiar with our program? No. Oh, okay, great. So I'm very excited to be here, and part of that reason is because I feel that we are the best kept secret. So often, I am a nurse case manager, so I go into homes in my role, but we also have nurses in the office and client representatives on our team. However, oftentimes when I meet with families, they tell me, why hasn't anyone ever told me about the program? Because of all the benefits for their family after working with us and getting enrolled in the program. And so my goal tonight is to really help you understand what the program is so that you can contact us directly, or if you know someone that would benefit from our program, that you will let them know to give us a call. And on that table is this particular handout with the heart. And this really is kind of a snapshot of the program. I could spend an hour here talking to you about the program, and that's not my intention tonight. I want to give you just a brief overview, just so that you kind of have an understanding of what we can do to help families. So essentially, our program helps to cover and pay for specialty care for children and young adults with chronic health conditions. It's all based on diagnosis, so you may think diabetes, seizure disorder, cancer, cerebral palsy. There's over 2,700 diagnoses that we may cover. And so we cover the specialty care. The diagnosis alone doesn't necessarily qualify. However, it's based on severity, that it has to have a treatment plan, and it has to require the child or young adult to see a specialist. And that's the provider that's prescribing all of the care. So what can we cover? We can cover specialist visits, hospitalizations, procedures, prescriptions, medical equipment, lots of things that we can cover. Even transportation, like mileage reimbursement, which when you've got families traveling back and forth to health systems, that can really add up for gas money. And so it's kind of a program that covers, if you think about it, specialty care. So the name Children's Special Healthcare is a misnomer. It actually covers people ages birth to 26 And there's a few conditions that are lifelong for adults, such as sickle cell disease, certain clotting disorders like hemophilia, and also cystic fibrosis. So those are like the lifelong conditions. The other thing people don't realize, they think, well, you know, I've got private insurance, so why would I need this program? Our program works to coordinate with private insurance. Even if you have 2 private insurances, for example, for a child, Children's Special Health Care would then be the payer of last resort, so there would be no out-of-pocket expense for the family for specialty care, and it helps families meet their deductible. Many families have $7,000, $10,000, $15,000 deductibles, and so our program helps to meet those deductibles. If a child or a young adult has Medicaid or an Adult Healthy Michigan plan, our program, there's no cost for our program, and if they're in a managed health plan, they automatically are enrolled in our program. So essentially, there's a lot of benefits for the specialty care. It's not comprehensive care, it's specialty care. So if you can remember that, so if they talk about diagnoses, you could think about referring them to our program. One piece is cost. So there's no income guideline in terms of you can earn as much money. There's no requirement for a certain income level, but there could be a cost for our program. It can be as low as $10 a month, and at most, currently for 2026, $247 a month, which it's a payment agreement for a year, and it's based on the number of people in your household and your household income. So for some people, it might be very cost effective, especially if they have a high deductible, to have our program. So that's kind of what our program offers in a nutshell. The other thing is it's a statewide program. So it's not just Oakland County. The program's embedded in each local health department in the city of Detroit. So if you know families in other counties, please refer them to their local health department. And the reason why it's embedded in the health department is because public health is kind of the experts on community resources and linking people to programs within their community. So my role as a public health nurse, I visit homes in my role. Not all families need or want a public health nurse in their home, but they can call our office and receive the same really essential level of care just over the phone. And essentially just working with families to link them to programs such as Oakland Community Health Network and programs within the county, and help them kind of navigate healthcare systems and complicated healthcare systems, barriers to medications, outpatient therapies, things like that. So in a nutshell, that's kind of my role. On a caregiver note, personally, I have a 90-year-old mother and a 93-year-old father who live independently. So I'm very excited to hear on the panel what they have to offer, as the ebb and flow of caregiving is continual in my life for my parents. Thank you.
Thank you. My name is Annette Werner. I'm the Director of Education for a home care company or private duty company called Comfort Keepers. I'm also a certified dementia practitioner, and I've worked with the Alzheimer's Association as a support group facilitator for 20 years. So my heart is with families, educating staff, training our staff more on person-centered than task-related. I see a lot of that in our industry, that they want to do chores, they want to bathe them, but they're not talking to them. And because you have a dementia doesn't mean you can't do. So my role is to try to educate professional staff as well as families on, because their brain is changing doesn't mean they can't do things. So my heart goes out to anyone caregiving. I was a caregiver for my own husband for 7 years. He didn't have dementia, but he had kidney disease. And being a caregiver, after a while, I found you lose your identity. I'm not raised wife anymore, I'm raised caregiver. And you don't mean to do that, but you get so involved. And then after he passed away, it took a while to get back who I was. And I can see that with caregivers, that you become so involved in doing for others that you don't do for yourself. So hopefully I can provide some information tonight that might help you or give you some resources that you can utilize. And one good resource is the lady next to me. Do you want my
Thank you. Good evening. My name is Kerri Gentry. I'm the manager for the Adult Day program at OPC. Before that, I spent, is this on?
Yeah.
Can you hear me?
You kind of got to get pretty close. So
Pretty close.
Don't be afraid to lean in.
So I'm manager of the OPC Adult Day Service. Before that, I spent 25 years working with caregivers in various capacities, running different programs. Like she said, I'm very passionate about making sure that caregivers are heard. I think that's one of the most important things, and supported. So my quick question was, has anyone heard of Adult Day Service? Good, okay, we have several folks. Annette wants to know if you know what it is.
You know.
People are nodding. Okay. It's essentially for a safe place for people to come and belong together with other people that have memory loss. And it's also a benefit to them. It's a benefit to the caregivers as well. So I hope I can offer some assistance as well. OPC has so many programs. I could be up here all night discussing what those are, but we did bring the newsletter, and it's over on the counter if you'd like to look at that. Page 20 through 22, something like that, are all of our supportive programs. I also run the caregiver support group, and we have several other support groups as well. So I encourage you to pick that up. Thank you.
And last but certainly not least, hi everyone, my name is Julie Lowenthal. I'm the Advocacy Manager at AgeWays, formerly Area Agency on Aging 1B. Yes, it is a mouthful. The 1B is our region locator. That's why we changed our name. We serve a 6-county region, so basically the seat around Wayne County, and we are the largest area agency on aging in the state of Michigan, serving 30% of the aging population and adults with disability population in the state of Michigan. At the agency, I focus on all things policy and also community and coalition building. So working on ACLS funding, so Older Americans Act funding, and making sure we can get more in-home care and Meals on Wheels funding through the state. And then on a contractual basis, I'm actually also on my side working with the federal government at the ACL on the National Caregiver Strategy, which will hopefully be updated and submitted by June. And so we're really looking at how federal partners can work on caregiver policy together. I have never been a caregiver, but I have helped family members here and there as I've grown up. And I'm excited to be here and hopefully can answer all the questions you guys have.
Thank you all so much for your introductions. So our goal tonight is to provide you with information and resources that you might not know exist, and to hopefully help you feel a little more informed and supported in your own community. So we're going to have a little bit of a discussion up here, and then we're going to open up the floor so you're welcome to ask questions. And then, of course, we'll just keep talking as long as we're here. So some of you shared the resources that you have available for caregivers. And I know kind of the first step when you're a caregiver is that initial ask, and it can feel very overwhelming. What is something that you wish caregivers knew when they started out seeking assistance? Any resources or tips you have for that first step in getting help?
I can.
Go ahead.
Educate yourself. Contact whatever type of disease you're dealing with. Go online, look and see, do they have any programs available? Do they have any money available? Start there. Alzheimer's Association has a 24/7 hotline or helpline. They call it helpline because it's actually staffed by counselors. And they can answer any question that you might have. I mean, if you're having a difficult time handling someone in the middle of the night, you can call and they will give you tips on what you might want to do. But educating yourself and finding out what the resources are within the state of Michigan is critical, because, and also checking out if the person is a veteran, what veteran benefits might they be eligible for? Because there is money from the VA, and it's called the aid and attendance benefit, that can help pay for home care, adult day programs. It can help also pay for assisted living if you have that. But it's extra money, but again, it's income. And if you served in a ward when you were in the service. But all of that is online. But go to the website. Be prepared. Don't just, and you know what? Ask for help. Mm-hmm. So many of you don't ask for help. You think, oh, I'm going to do all of this by myself. I'm sorry. You can't. You need that assistance. You need that support. And everybody in a family isn't a caregiver. I know that for a fact. And you're like, oh, I'm doing this and I'm doing that. Well, guess what? You say, okay, I'll take care of mom, but you're going to do the grocery shopping. You're going to go to the bank. You're going to take mom to the doctors because I can't do it all. And then the 100% take care of you. What do they say in an airplane? You know, the oxygen comes down. Who gets oxygen first? You do. Well, the same thing, because if something happens to you and that person that you're caring for, who's going to care for them if you die or you wind up in the hospital? That's my advice.
I can share.
Thank you, Annette. Sure, go ahead.
And I failed to explain a little bit about what we do in Rochester.
Sorry, me too.
So in the district, I'm representing 2 different age groups, birth to 3. And then 3 to 5 year olds primarily. And in really any community, you can receive services or an evaluation for your child. So we've had even mothers who found out they're pregnant with a baby with some type of syndrome or something like that. And they've actually called us while they're pregnant, knowing that when they have their baby, they're going to need to get some supports put into place. So we have brochures up there. If you know of anybody who is birth to 3 and would like to get their child evaluated through early on to see if they might qualify for services like speech and language, occupational therapy, physical therapy, social work services, we are able to do that through the local school districts here in Oakland County. And then if children qualify, it's free for them. There's no charge for the services, and they can be, and birth to 3 services are provided in the natural environment, which means the staff go out to the child's home and work with them in their home environment or in their daycare environment if they're in a daycare center within the school setting. And then we have what's called Child Find, which is our 3 to 5 year olds. We also offer evaluations for them. So if a parent or a caregiver has a concern about any area of a child's development, or if the pediatrician is concerned, parents can contact us at any district. Rochester, I happen to work for Rochester, and every district has what's called Child Find. And those children in the age group of 3 to 5 can get an evaluation. If the only concern is like speech and language, they could get a speech and language evaluation. If there's more developmental concerns in other areas, they can get what's called a full evaluation, where we look at all of the child's area of development to see if they qualify for special education. And again, if they do, they can get free services, as I mentioned, speech, social work, OT, PT, and a special education teacher support. And that is also free through tax dollars that are paid for the local school districts. And I just want to say, with working with the youngest population of students and caregivers, my advice would be not to be afraid. It's scary when you're taking the first steps, but we are all here to help you. And I would say surround yourself with people who are going to be a support to you. Reach out to families that are going through similar experiences as you, because they are truly the ones that understand the best what it's like to be raising a child with a special need, or what it's like to be caregiving for somebody that has dementia. On a personal note, I will share this because it was something personal, and I found it tremendously helpful. I had a stillborn baby before I had my own 2 children that I have now. And Beaumont Hospital, now Corewell, was wonderful in linking me and my husband with support group with other families that had lost a child or an infant. And that was one of the most helpful things in our lives, was to be connected with other people that were going through the exact same thing that we were going through. And helped us with our grieving process and moving forward. So just remember, no question is a silly question. And I would just encourage you to surround yourself with others that are going to support you and, understand what it's like to go through what you're going through, regardless of what age continuum you're on.
Thank you for sharing, Andrea. Anyone else want to speak to advice? Go ahead.
To the point about connecting with other families who are sharing similar challenges, I think that's hugely important. We in the public mental health system we've leaned into that a lot for services for youth. Less so, I think, with adults who have serious mental illness. I think that is probably an opportunity. Although I will say the things that we've seen implemented for adults with serious mental illness, not a lot of families have taken advantage of them. I've seen programs kind of start and then fail to continue because there was just not a significant amount of interest. So I think that has to do with probably some stigma in that area. But so the thing I am generally advising people to do when asked about this is start asking the questions early about how you can get connected to other people who have shared the same lived experience as you. We have clinical type services where families can get kind of like training and how to do behavioral interventions at home, things like that. But then we have other options too, like parent support partners, for example. So if you have a child with mental health issues or intellectual developmental disability, a parent support partner is a person who has also had a child receive services in the public mental health system, has that lived experience. And as we know about public service, lots of times it can be sort of convoluted, not easy systems to navigate. They've done that too, so they can be a tremendous resource just from a practical perspective as well. So.
Thank you.
Can I share something?
Please do, Beth.
For Children's Special Health Care is a statewide program. And so there is a family center, which is actually called the Family Center for Children and Youth with Special Health Care Needs. And it's not just for children enrolled in Children's Special Health Care. It's for any family whose child may have or potentially may have behavioral, intellectual, physical, developmental disabilities. And the center offers an array of services. And one of the most recent, they've really increased their virtual support links so that they have virtual support groups, which are parent-led. So we were talking about other families that understand your journey. It links you to support groups and also one-on-one support. So if you're perhaps a grandparent even caring for a child with special health care needs, you can be connected with another grandparent specifically, even with similar diagnoses. And even if it's a rare condition, there's a network across the United States that they can connect you with another parent. So the same, I do home visits. So oftentimes when I meet families, they're so isolated because they're caring for sometimes 1, 2, even then you have the same generation, they're caring for elderly family members who also may have some challenges. So that getting the support and sometimes taking that first step for virtual is a little less intimidating than how can I get out of my house? Like my time is spread so thin, and taking that time for themselves, I think that's the message I tell. Build your village. Like it takes a village, and so many people are isolated geographically from their family, or also the hands-on care too is another piece where, yes, they have social support, they can call family, but there's not that physical support to assist them with the hands-on needs of caring for their loved one or their children with special needs. And so the physical demands of that, the financial demands, the emotional demands, we see that. And so part of my role is trying to support them with linking them to different services and providers so that they get the support that they need to free up some time too, so that they get their own personal support.
Thank you. Go ahead, Julie.
So from the Aging Network perspective, so first off, in the national strategy, there's been a huge national push to recognize caregivers. So 5 years ago, almost actually even 10 years ago, we did not, we're at 68 million caregivers now that are identifying as a caregiver. But back then, no one identified. It was my mom. That's just what I did. I took care of her. You didn't say, oh, I'm a caregiver for my mom. And caregiving can also take, is a spectrum. So you could just be a financial help for your parent or financially helping them from a distance. You could be more hands-on. You could be helping coordinate medications. So there's a huge spectrum. And I think the first step for any caregiver, if you have friends in the community that are taking care of someone, whether it's an adult or a child or anywhere on that lifespan, is to help them identify. Because once they identify, then they can get the resources that they need, whether through any of these amazing childhood programs or Area Agency on Aging. And now I'm going to do a quick plug on Area Agency on Aging. We're a national organization by an act of Congress. Basically, I call us the phone book of the aging services. So we work with the library, we work with OPC, we work with all of the different groups. But if you're just looking for any resource known to man, you call us and we have options counseling. So if you're like, hey, I don't know what I need, but I need something, you can call talk to one of our resource specialists and we can get you connected to the right resource that would work best for you. And that's my quick plug.
I love plugs. Plug away. Anyone else want to add any thoughts? Well, thank you, Julie. You raised such an amazing point of the identity of the caregiving, and we're sharing a lot about resources for caregivers when you're caring for someone else. But what about the caregivers themselves? Do any of you have any advice or resources from your own organizations that are to help caregivers find a little bit more support, maybe lean a little bit more into that self-care? Annette made the great analogy of put your oxygen mask on first. Does anyone have anything they'd like to share about really making sure that you take care of yourself so you can take care of others? Go ahead, Julie.
I'll plug into that too.
Plug.
So, and I'm going to talk quickly statistics. Statistically, caregivers are actually known to neglect their own health because of their caregiving roles. And what we have seen is that as a result of that neglect, their health is starting to decline, but then the person that they're caring for actually declines more rapidly as a result of that. So for Area Agency on Aging, we do have a really cool class called Powerful Tools for Caregiving. Every caregiver that I know that's ever gone through it really, really likes it. And then we are working on trying to build some of our other programs, but we do contract also with, OPC has support groups. They have the adult day programs. Even if you get someone into an adult day program for 1 day a week, that gives you the ability to go grocery shopping or go take care of yourself or do any of the other, maybe the pile of laundry that you've been neglecting because you just don't have the time to do it.
And I would add to that too, that while we talk about the adult day center and how that's very important for someone who has a memory impairment to feel like they're part of something and have a purpose, when you're taking care of yourself, as an example, we have several families that will drop their loved one off and then go take a class, exercise, get themselves moving, or maybe alternatively they'll use our transportation to make sure they get to their doctor's appointments. So many caregivers don't go to their doctor's appointments because they can't get out, they can't make it. So there's a theme here, but you really do need to take care of yourself if you're going to take care of anybody else.
I would say from the childhood lens, there are resources called respite care programs that you can utilize where it provides care for your child. You have to qualify, and maybe some of you can speak even better about it. You qualify for a certain number of hours, and then those hours can be used to provide care by somebody you know, or they are respite care workers. And that parents have utilized it, and they don't even have to leave their home. They could do laundry. They could take a shower. They could watch a movie while somebody else is in their home caring for their child, or they can leave the home and go out and have date night with their husband or do something fun. So I would say look into respite care services. because those are a wonderful way to work on self-care and create time and space for self-care, knowing your child's being cared for by somebody who's, skilled to watch them or knows them well, things like that.
If that exists in the Aging Network too.
Mm-hmm. Yeah.
There's just wait lists for that one, so I don't like to talk about it as much as I don't have to.
I think there are respite programs available. Alzheimer's has a respite program. ALS also has a program where they pay a portion of a caregiver's wages as well. But there aren't a lot of respite programs available for the elderly, unfortunately. And usually it might be $1,500. Well, but it would give you the time that you can leave the house and take a break. Mm-hmm. And the $1,500 you could use however you want, adult day programs or in-home care. So that is one way that an individual, and I know I asked her a question for the area aides, is a new program that I don't know much about called the GUIDE program. And it's supposedly Medicare has some involvement with this, but I don't know what it is other than they are going to be able to provide care or funds. So I'm hoping that you and I will find out more information about this new GUIDE program, because there needs to be Medicare involved some way to help families pay for care. That's my own personal opinion, because the average family, someone who has a dementia could be anywhere from 5 years to 20. That's a long time. That's a lot of money. And most families don't have that. So I think communities need to come together to find solutions, because the aging population is just going to escalate. And what other resources do we have? So I think communities need to put their heads together and say, oh, let's try to do this or have this program or get involved. We were talking about intergenerational programs, getting high school students coming in and entertaining, or getting a high school student maybe who wants to volunteer some hours to help you do your laundry. I think programs like that, we need to think out of the box a little bit. What can we do? Start young, because elderly people love kids. They love being involved with that. But how do you start with that? Everybody's asking about the dollars and how much does this cost and how much, and there aren't a whole lot of programs, unfortunately. The VA program has, we're a vendor for VA, and they have a program where you can utilize your family members to do the care for the veteran. And our company has to train you, and then we pay you wages, and you only work for your mom, your dad, or whatever. So, which helps, because, should you have to give up your pay to be a caregiver? Maybe businesses have to think about flexible schedules or working remotely from home, because why should they be penalized financially? Some employers have programs, but a lot of times the employees don't ask what those programs are. So that's one of the things you could do as well. Does your company have any programs that will help financially?
Thank you. Go ahead, Beth.
Because you brought up respite with children, children's special health care does have a potential respite benefit. However, it's quite limited. It's only 180 hours for a enrolled children's special health care client's eligibility year. So it's 180 hours for a year. And the care needs have to require the level of a skilled nurse. And so many of the families that we see, their child's care needs aren't actually at the level of a skilled nurse. It's more what we call aid attendant care. And so as a result, we often refer and find avenues to Oakland Community Health Network's services through their access line. However, and perhaps we'll talk about the Children's Waiver Program as one you may have heard of. The other option that we talk to families about, if they have a child with special health care needs that may potentially, if financially they were within the limit, could qualify for Social Security, like SSI, disability for their child. If they're over income for that, there are pathways to Medicaid because some of the services, such as respite care through Oakland Community Health Network, requires Medicaid. So our office talks with families, even if they're not in children's special health care, to see what the needs are. And if respite is one of the needs, and depending on their child's situation, even behavioral, not just medical, we might be able to support them looking at pathways to get Medicaid, to get like respite care and other wonderful services, like supports coordination with a social worker and other services available. And one pathway is called TEFRA. And essentially it's a program that we support families with submitting documentation to see if their child is eligible to meet the criteria to obtain, as if they were disabled, if they have a significant disability. And if that's the case, then the child applies for Medicaid as a household of one based on the child's income and assets. So essentially waives the household income for Medicaid, and we get the child access to Medicaid so that they can get comprehensive Medicaid, even secondary to their primary insurance, and can then get services such as respite care is one example. And so we work with families, and there is a shortage of respite workers, and there's pay concerns with respite workers, but at the end of the day, I can tell you how many families I've supported with seeking services, for example, through a community health network, either children's waiver or TEFRA, and getting Medicaid and getting services in place, and families have time then, time to go out, get that break, take a shower, get some social interaction, and can leave their child or their loved one with someone who's trained and getting paid to care for them. And it can be life-changing for families, like truly. Oftentimes families will say, I don't trust to have anyone in my home. I only trust myself caring for my child. And I understand that, but I work with them to consider, like you said, if you don't take care of yourself, then what's going to happen to your child? And I get calls quite frequently with parents worried about their own health because they're so depleted. And they'll say, tell me what's available for my child if something happens to me. And I say, let's start with you. What can we do to support you to get time to go to your medical appointments and to get some sleep, right? So how can we, if there's not those natural supports, which is a problem, what can we do? And so Oakland Community Health Network is one of the systems that we frequently refer to and support families to utilize.
There are some pathways to Medicaid that I think are important to know about. And there's a respite service generally affiliated with each one of these. And they work as she described. Yes, they for a child with intellectual or developmental disabilities, they essentially look at that child as a family of one. They're sort of waiving all the other Medicaid requirements around income that the family would have, and they're just looking at that child as a family of one. And that opens, if determined eligible, and then connected to a provider in our system, that really opens up a pretty robust array of services, including respite. I think that it is a challenge to find respite staff a lot of times. I think this is probably the case across all populations we're discussing up here tonight. One of the things that we can do, and I think we do it pretty effectively in the public mental health system, is we can find some flexible ways to work with families to find and hire staff. And it could be to the point about, I'm not comfortable leaving my loved one with someone I don't really know. It could be somebody you could hire somebody and pay an individual who's a family member, a family friend, somebody from church, somebody who's familiar and that you would trust to care for your child, trust to be in your home. And that really ends up being a great option for a lot of people. So I think that in addition to that, there are some adults who have intellectual developmental disabilities who can be eligible for respite services in our system as well. And similarly, there's flexible ways to find staff to fulfill that duty for your family. I mean, this probably goes without saying, but it's a service for the family. The respite is for the family, right? It's not respite for the individual who's receiving the services and has a medical condition or a mental health or intellectual developmental disability condition. It's respite for the caregivers. Yeah, so that's really baked right into what we do.
Thank you. I'd like to take a moment. Are there any questions from the audience if we want to? Got a lot of really great information. So I want to throw it all to you guys. Yes? Okay. I'm going to set up this microphone. So Kathy, come on, you can do it. All right. Well, you project and I will repeat.
Kerri, what are the
Rochester Hills, and Oakland Township residents, and if you live outside that area, you can still join. It's a fee. Mm-hmm. Is it $225 for an individual and $350 for a family?
$225 for the whole year? I said you have to be a registered member before you participate in the So as a member, then you still pay a fee. Oh, okay, like everyone.
Yes.
Okay, but if it's $225, you will pay it.
Yes.
Did everyone hear that? That might be interesting. Okay. Any other questions? Michelle's got a mic.
There in a minute too. We're recording it for other people and it only picks up the mic.
This is for AgeWays. My mom was automatically enrolled into this DSNP program. You've heard of it?
What do you know what the whole abbreviation is? There's a lot of abbreviations in the aging network.
DSNP High, I think she's in. That's all I know. It's part of Medicaid.
The Medicaid, the My Choice
Waiver.
Program? Okay, the My Choice Waiver program.
Yeah. What is the, so she was automatically enrolled into it. I was trying to get into her the waiver program. I'm having a tough time getting her out of that so I can go into the program I want her in. But I don't know what the advantages and disadvantages of DSNP are compared to the waiver.
I'm going to Google that real quick. So we run the Medicaid. So a lot of people don't know Medicare does not have long-term care. There's nothing in it. So you have to go into Medicaid. So with the One Big Beautiful Bill, there was cuts to Medicaid. The My Choice program is our in-home service program through Medicaid. It is an optional program though. And so that is a program that can be cut with these cuts that are potentially coming down, although we don't think it will, because it does save the state $50 million a year. So why would you cut a program that's saving the state a lot of money? We're not really sure yet, but we're going to try to fight for it. So let me get back to you because I don't actually know that particular one. But that being said, the Medicaid program, there is an income limit. You basically call any of the waiver agents. You talk to one of the dual eligible program. Okay, so she's Medicare and Medicaid eligible. DSNAP. We'll talk after because that's a complicated program that I really don't have time to talk into right now.
Get her out of it.
We'll talk after.
So now you see how it works if you get it really close. My mother actually has just gotten a dementia diagnosis, and she lives on the other side of the state. So I've been doing a lot of traveling, and she's in a wonderful facility over there that still is able to keep her in independent living and provide services to her. But the biggest problem I have is all of her healthcare appointments. And while they can get her there, I don't really have somebody to advocate for her while she's in the appointments. And I have tried getting on speakerphones and doing things like that. And I don't know if there's any services that can assist with being that healthcare advocate from a distance for me.
One thing you can look into are care managers, geriatric care managers. They can do everything from going to the appointment, driving to the appointment, coordinating care. It's just one idea.
I'd also reach out to the area agency on aging over there, and they can get you connected to a resource. There's probably a patient advocate program with volunteers that might be able to help you out. I do know nationally there is a push to try to get caregivers more integrated into the healthcare system. So like if you are a distance caregiver, being able to get you that access without having you sign 1,001 documents, because that's the other thing.
Listed as for in so many places, and yet they don't see it, and so you have to go back. And
But yeah, I would call the area agency out there. If you go to 4AMI, which is the Michigan Association, like for all of the area 16 of us here in the state of Michigan, you can like search up which one is there, and then they can try to get you connected to a patient advocate.
Thank you. I'm a caregiver to my husband, who has some health conditions, not life-threatening disease. Also, he doesn't have any cognition or memory issues, but basically it's physical. He has mobility issues. At this point, he's not at the stage where I don't feel comfortable leaving him to go do grocery shopping, take a shower, laundry. No issues there. However, he cannot be left alone for a very extended period of time because he needs medication reminder and things like that. My question is this. So last year, I had to travel interstate. I had to go to other states. And I had to be basically out of state for 5 days. My husband said he wanted to go to basically he is not comfortable unless he received round the clock care type environment while I was gone. So I visited, from facility to facility, do you provide respite care for 1 week? And almost everybody said, no, he has to stay for at least 1 month or at least 2 weeks. Finally, I found a place and I was even able to use his long-term care insurance and get some reimbursement. But and to be honest with you, some of those facilities were downright rude. So I said, I don't want to talk to you. I don't want to deal with your insurance company kind of attitude. But anyway, so fortunately, I found a place. But is this common? I mean, is this a usual, the normal state? Yeah.
Usually for that type of respite, the community that has the empty beds, they require you to stay 3 weeks, sometimes 4 weeks. But you also can hire private duty to come in for short-term jobs. So if you call the private duty agency, they charge you an hourly rate, so it will be more expensive. And you could say, I'm going to be gone for 5 days. I just want care for the 5 days. These are my husband's needs. They send someone out to do an assessment, see what type of caregiver. If you feel they need 24-hour care, 5 days, you're looking at an average of about $35 an hour. So I can't get somebody to stay overnight. I mean, for that. Oh, yes. Okay. I wasn't more than likely. Okay. At least what we do, an 8-hour shift. So you might have 3 different caregivers on that 24 hours. Because keeping a caregiver there longer is not good. So you want fresh eyes, so just like shift workers, they'll work 7 to 3, someone will work 3 to midnight, midnight to whatever. So in the future, so you can call any private duty. We're a franchise, Comfort Keepers is a franchise, so we do background checks before we can even hire someone. They're bonded, they're insured, they're covered by workers' compensation. We want to know what your husband is like, what would he enjoy, what activities does he like, because you're spending a lot of time with them. Yeah. So you're paying a lot of money, so you want to make sure your husband's doing things that he's enjoying while they're there. Okay. Where can you go to get more information? So look up private duty agencies. And there's a lot of them. I have to tell you, there's a lot of them. And interview them. Just say, I want to ask, I get phone calls like that all the time. What do you charge? What type of insurance? You know, what kind of background does your staff have? You know, what are the needs of your husband? And that's the type of caregiver we would look for.
Okay, thank you.
Hi. So my mom also was diagnosed with early dementia in the last 6 to 8 months. I'm 30, so I feel like I'm fairly competent, but looking at the Social Security website and Medicaid makes me feel like I have the dementia. So I'm not really sure if is there any resources available to help me. You know, I got my own family and we're dealing with our stuff, and to help my mom because she lives by herself. She's not married. She doesn't make hardly any money, and trying to navigate that is terrible. So is there anywhere to help me do that, to get her enrolled in Medicaid and Social Security and disability and all that stuff, short of a lawyer?
Yes, Area Agency on Aging. Okay. We have the SHIP program, which is basically it used to be called the MAP program. They changed it to SHIP, but it's the Medicare Medicaid Assistance Program. Also, since she was just diagnosed, make sure her legal documents are actually in place now. Otherwise, you will end up in probate court. And while probate court is great, I work really closely with a probate court lawyer. And there's a lot of really cool mechanisms that we do not talk about because we think it's bad. Get the documents in place now.
Yeah, that was the first thing we did. So,
yeah. But yeah, I know the Attorney General is working on. Dana Nessel has been working on some really great documents to help people kind of navigate the systems. But yeah, I would call my agency. We have a 1-800 number if you go to our website. There's also the Connect guide I think I saw floating around somewhere that can help you walk through some of that. Yeah. And I think OPC also offers it, don't you guys? Oh my God, do not.
And the booklet, and there's an OPC newsletter over there. It has hearts on the front of it, and we do have counselors that can walk you through that. You're welcome.
Any other questions? Oh. Here come the microphones. If you could raise your hand again, I don't know if Michelle caught y'all.
Here, we'll start at the back.
My mother was diagnosed with dementia probably under 10 years ago. I am not sure how you arrive at a dementia diagnosis. Is there mental competency testing, and who would help arrange for that to determine how advanced that dementia is, short of a doctor? I don't know how to go about finding that.
Typically, it's a neurologist who would do that, right? A geriatrician, same. Sometimes it's an internist that has a heavy background in geriatrics, but you want to be, dementia is an umbrella term. Just like cancer is an umbrella term, dementia. The latest research I read just about a week ago, there's 200 different kinds of dementias now. So, most of us think of dementia, we think of Alzheimer's, Lewy bodies, frontal temporal, vascular dementia. Alzheimer's, 60 to 70% is what the diagnosis is, So you always want to have it. Alzheimer's Association will tell you want a definitive diagnosis. If you're not sure of where you want to go to see a physician, call that helpline and say, I'm looking for a neurologist locally in this area. Is there anyone you could recommend? I know Henry Ford has a system where they'll do testing. Corwell has a system where they'll do testing. The testing sometimes for those individuals who have the dementia is totally overwhelming. Some of them will walk out because they ask questions that they'll say, that was a stupid question. Why did they ask me that? So it's difficult. You mean the assessment that you're going for? Yeah. The assessment, typically your insurance and Medicare would cover it. Yeah, because it's a diagnosis. And like she said, once you have that diagnosis, you better get your ducks in a row really fast. Because once someone is determined that they're mentally incompetent, yes, they should not be making decisions. So you want
your power of attorney, medical, as well as financial.
But you should have those ducks in the row even with the childhood stuff too.
Oh yeah, I agree.
Like the parents should have their ducks in a row for caring for their children, but those experts can talk to you about that.
Definitely.
And I will say, we were supposed to have Dr. Hardy, who is a neurologist with Henry Ford Health. He unfortunately had an emergency at home, so he wasn't able to make it tonight. But if you have questions about how the diagnosis is made, he has offered to answer any questions via email. So if you'd like to send him an email with your questions, I have my card here. You can send it to me, and I'll pass it on to him, and he'll get in touch for anybody.
No. My mom's playing and she's very forgetful now. The physician she's with me has already said that her slum score, that's what they're doing, based on some of the facts. Yeah. My question is, after a party that we feel very social, we all
They can do MRI to look at the brain. Yes. Yes.
They do PET scans as well, but typically insurance doesn't cover them. But now they also, and I don't know if they started them, are they doing the blood biomarkers yet? Do you know?
Not covered by insurance yet.
It hasn't been approved
Not by
yet.
insurance.
Yeah.
whether they even do that on
They will.
I'm sure that they would.
But I don't know what the benefit of that would be.
I agree.
Her PCP already gave her kind of a, did the testing. So she's 99. I mean, she qualifies based off of just that score alone for a lot of services. So doing anything more than that, you have to weigh like the pros and cons of like, is this doing more harm than good? And I would probably lean towards it's probably doing more harm than any good. Just get her the resources that she needs to keep living as independently as possible. Yeah.
The slum score can tell you where she is on a range for her memory ability, but it's not going to tell you what type of dementia she has.
How long has this been going on? How long has it been going on?
We've noticed it for about 6 years, and it's significantly altered and gone down. And in about 8 months, she was back up like this. And he did give up. I mean, good people verbal, walk.
So I'm in a similar spot as him. I have younger kids and elderly family members. Looking for maybe support on like grocery shopping and transportation and Meals on Wheels, but not interested, and wondering if there's any tips on how to get them to buy into some of those services so that it gets off my plate.
That's literally the $1 million question.
Okay, so I'm not alone.
You're not alone. They never want help. Never.
They don't need it.
I don't need it. I've been told I don't want a babysitter. And it's your approach. It's like, you know what, Mom, I am concerned. I can't help you as much as I want to help you. I want to do this for me. It'd make me happy because, Mom, if I get sick, who's going to help you? So this helps me, Mom. Would that be okay? You could just, but, it's not.
We offer a resource. Look on our website. It's called TrueAlta, and it's a online I don't actually know if there's space on it anymore, but like from our agency to pay for it for people, like make it free. But it's an online platform that offers one-on-one coaching for caregivers. It offers peer support for caregivers. It also offers like less than 10-minute videos on how to have difficult conversations. Just that's medications. Like you name it, they're like 2 to 10 minutes only because they know that caregivers only have that amount of time. It's called TrueAlta. You can find it on our website. We had a grant to make it free for X amount of caregivers. Can you speak to the microphone? Sorry. It's called TrueAlta. I don't know if we offer it for free anymore. Like, I don't know if we have, the free part is interesting, but look it up. It's like TrueAlta. I don't know. Look it up on our website, AgeWays.org. But it's a really cool platform. It's a really cool, a lot of area agencies are starting to utilize it. They even have kid resources on there for family caregivers that have children. I think it is more geared towards older adult services.
And it's
literally the hard, you're in the worst, like it's the hardest situation you can be in.
Well, no, I feel like I'm feeling really lucky because we're not dealing with a lot of other things.
Having a doctor mention that it might be recommended, that can help sometimes.
Okay. I'm on stage for other people that are
Correct.
I have my out-of-town siblings
So that won't work because you're in this transition role at the moment of parent turning into, not the child, that's not the right term, but the parents no longer, the roles are starting to reverse. And so she's rejecting that role reversal and you're trying to fight your way into that role reversal at the same time. So your siblings doing it, not going to help because she will do the same fight with them.
And it's spelled TRUALTA.
Thank you.
Of course. Was that a question?
No. Oh, okay.
I just wasn't sure if it was. Like, I know we paid for X amount of people to get onto the platform.
Hi, I have a 37-year-old developmentally and intellectually disabled child, and I wanted to just put another resource out there that I'm not hearing mentioned. The ARC of Oakland County is outstanding. They can help you with the whole Medicare, all the funding. They can help you work your way through the maze and the piles of paper and all of that. And they also are building an online library with tons of resources. So when you're specifically talking about the intellectually IDD community, I would highly recommend you get a hold of the ARC of Oakland County. It's ARC. And almost everything that they do is free. Our daughter, who's had lifelong disability, was suddenly kicked off of her Medicaid. It's a long story, but we protested it, and the ARC sent someone with us to sit down in our meeting and iron it out, and it was ironed out in 5 minutes flat. They know. I mean, the greater society, the people you're dealing with all the paperwork, they know the ARC, and the ARC people know the lingo, and they'll really help you out. They also do some legal services as well.
And just to go off that, we have a flyer on our community bulletin board upstairs. The ARC and Oakland Community Health Network have partnered to offer an 8-week caregiver support group for parents of children with intellectual and developmental disabilities. Excuse my Mushmouth. So if you need any information about that, let me know and I can forward that flyer to you as well.
No.
For dementia, my mom has been diagnosed several years now, and we're going to see her neurologist again in February. And she's had MRIs, and they've just been general. I haven't looked at the paperwork. My brother is more in charge of that, so I don't have that information in front of me. So maybe it does have a specific diagnosis, but she was told that it was just aging. It's just aging. There's nothing. It's not real specific, and so should I? I mean, how do I proceed with that? Just kind of. What questions should I ask?
How old is your mom?
She's 88.
88. Well, from what I understand is that it won't have it on the paper, but the job of the neurologist is to look at where the areas are that are showing.
Yeah.
And it should, by understanding where it's happening in the brain, it can tell you a lot about what type of dementia it is.
Okay. Thank you. This really isn't, maybe a little bit of a question. So my brother, just to your comment a little bit ago, my brother had just posed, he lives with my mom, and she's, things are still pretty good, but she needs somebody with her quite a bit of the time. And when I go over, she'll go, me, like kind of laughing. And he just asked me the other day, he said, I feel like I'm lying to her all day long. When should we have a conversation with her and tell her you need us to? No, we don't. We just kind of just keep going around.
It's okay to tell white lies.
Okay. Okay.
A lot of times that's how you get through the whole dementia journey.
Okay.
You always have to be in their reality.
That's a good point.
Which is not easy for family.
Yeah. Okay, thank you.
Hi, I got a few comments and questions, I guess. So over 10 years ago, I was kind of young as a caregiver. My mom was really sick. She had kidney failure. I ended up giving her kidney. And then several years later, she had some issues. And my dad had issues. And for 3 years, I ended up living with them. And there really wasn't a lot of time. It was just one crisis after another. And I was like a MASH unit. I was doing wound care. I was driving them to every single appointment. And there was one time my mom was getting infusions, and I said, I probably don't need to be there for that. But you can't just get someone driving them to an appointment. You're their advocate. They have complex. So it's like I did everything. And ironically, during the kidney disease part, I was working full time, and I would just go, I have to work remote. Called before my boss was in, and I was using the term before it was a thing. And it's so funny that people work remote now. And it was just so one of my people that hired me said, how do you get to do this? Well, my mom had kidney failure, and you don't know what my life is like. But I found that it was so frustrating because neither of my parents had dementia, but my mom was a little forgetful, and they were living at, whatever, I won't go into that, but I wanted someone just to go check on my mom, make sure she had her meds, and leave. All the agents, no, we don't do that. We have a 3-hour minimum. It's like, I just need someone there to go see her. Well, we don't do it that way. And I know they don't. I know they got business models, but let's think outside the box, and someone needs to start doing that. I thought I should start a firm, but I'll tell you another thing that goes in with that. I spent so much time researching these medicine things that they put out the medicine for them. I said, but she has to take it and take it. It's not, and I felt like I'm the most problem person because nothing is going to work. So types of things, there are these nuanced things that they didn't work.
Look at interfaith volunteers. They're right around this area, and they offer
Interfaith?
Yeah, it's called faith. Yeah, and it's volunteers. So it's caregivers or people that were caregivers in the past, or
that's me.
Just anybody who wants to volunteer, and they'll come in for an hour.
Yeah.
And just come sit with your parents or sit with your loved one, check to see if they get the medication, and just show up.
For free?
Yeah.
How long have they been around?
A long time.
20 years? Why did no one tell me? Yeah. Okay. The other thing is, so that was a big issue. And then we did hire a case. Someone said, oh, you know what you should do? And so you go and you do it. You spend all this time calling up. And we had someone from, I think it was Henry Ford or Oakwood, to do a case manager assessment. We never used them. But if you want to have a case manager do it, I did. My dad was a doctor. He explained a lot. They all thought I was a doctor. They had complicated stuff. So who's going to go take him to the hospital, the ER? Well, a case manager who's very like an RN, they're $120 an hour. And if they're sitting in the ER for 6 hours, who can afford that? By the way, we were also a family that didn't quite fit. Certainly, we're not going to get Medicaid. And I always feel like the middle Americans sort of get really crunched. And my sister had to be on she has disability. And they cut off Medicaid from a lot of the the services that they offer to families if there's someone with a mental health issue. I can't remember what they're called. Easter Seals does it. And all of a sudden, nope, you're on your own because we only are Medicaid. It's called TNS or something. So there's just lots of people in kind of the middle where you don't fit Medicaid, you're not so wealthy that it's like no problem. So I think resources for that. And the other thing, I recently fractured my foot, and it's a nightmare just trying to get transportation anywhere. I wanted to come to the caregiving screening 2 nights ago. I couldn't find a ride, and I was like, what's Uber going to cost me? It would have cost me probably easily $20 one way and $20, close to $50. And I'm like, I guess for a one-off I could do that, but how many people can do that? And I was just talking about OPC. Oh, no, we're kind of done with the day people. Nighttime is devoted to pretty much dialysis patients, which I know about that. And I said, well, God bless you. They need that. People with disabilities that have jobs, so I said, why don't we have a community interfaith, I'm ready to hitchhike. I wish we had resources like that. Can you give a ride to someone? I'm like, if I'm going to Whole Foods, does anyone need a ride? I'll drive you. Are there resources like that, like you just told me about for the interfaith? Rides. I know seniors have huge issues with driving.
There's also a program called My Ride Too that can help you have those difficult conversations. They can help arrange smart buses. They can help arrange Lyft and Uber for a reduced cost. In terms of the middle American people, okay, so there's two pots of funding. When I talk about the funding that my agency deals with, there's actually two pots. So there's Older Americans Act funding, which then trickles to the state, and then our state actually puts in more money called Older Michiganians funding, and then that gets trickled down. So that's your Meals on Wheels funding. We do ACLS funding, which is for the non-Medicaid in-home services for non-Medicaid eligible older adults and adults with disabilities. Support services, there's a whole range of them, including Advocacy, the Information Center. That's the Older Americans Act funding. You just have to meet the age criteria, which I think is, well, that one changes a lot, but it's like 60 years or older, I think is what the federal made it this year. But then there's some programs that are 65 and some that are 55. So it fluctuates. That's in that. And that's Older Americans Act funding. Then there's the Medicaid funding. And the Medicaid funding is for only Medicaid eligible older adults. So that's like so we did get the asset limit. So now you can have $10,000 in assets. So if your house breaks down, you can actually have $10,000 to fix it. Luckily, because it used to be $2,000. But you can only make about $2,800 a month or something. It's it's a very, very small amount of money. So you have to be Medicaid eligible in order to get in. But Older Americans Act funding is for everybody. Anybody who's an older adult who qualifies as an older adult, you can go into that pot of funding. You just call and we can get you in programs. And OPC is really a great resource for you. I will just plug. You guys have one of the best older adult groups in the county. Yes.
You just mentioned My Ride Too. One of my pushback on OPC is you have to schedule it in advance, and they don't like that. So My Ride Too, can I call and have someone come that day?
For Uber and Lyft, they can help that. So for you, it would, because you would do it with your own phone, it might make sense for you just to call the Uber yourself and have them.
But it's not for me.
I mean, like if you're, let's just say your mom is like, I'm trying to get from point A to point B, but she does not have a smartphone. We can help assist to get that arranged. Like your mom could call. I'm just saying. Like,
I know my mom. Not my mom.
I don't know. The person. Okay, the loved one you were referring to can call. I would say if you are the one that's trying to arrange the ride, it might just make more sense for you just to do it on your phone and just be done with it.
So with a phone number that she could call, that would be really cool.
AgeWays.org. Go to AgeWays.org and all of that information is sitting right there. Everything you possibly need, those Connect guides are on the website, including all of the resources that those Connect guides talk about.
I think we have time for one more question, if there's one out there. Sure.
I was a caregiver for my mother for about 10 years, and I had two sisters, and neither one of them got really involved. My saving grace was to remind myself that I would never have to get that they can wish that all they want, but I don't know.
It's a beautiful ending to this whole thing. It's putting into perspective to remember at that point.
Thank you. I did have one final question because I would like to live in a better world, and I think we all would. So I want to ask each of you for the last question, what's one change? If you had one wish, what's one change that you would make to our culture or to our society that would make it easier for caregivers and caregiving? And if we want to go right down or if you want to speak one at a time, however.
Sure, I will go first. We are all sitting here staring at each other. I want caregivers to know that you don't have to have a clear plan. You don't have to know. Biggest thing is just recognizing that you are a caregiver and then knowing that there are resources and supports out there for you. So reaching out is very, very key. One of the key principles of that national caregiver strategy that I talked about that's happening nationally is that we're reducing those complexities and burden. And that starts with just, meeting caregivers where they're at. So you're not alone. Sorry, I thought it was loud. Just know you're not alone. More people than you think are caregivers in some capacity, whether that's a distance caregiver or someone who's hands-on here every single day, or a parent taking care of their child. Everyone's a caregiver. You're not alone. The first step is just saying, yes, I am a caregiver, and helping other people say, yes, I'm a caregiver. And then just recognizing that, and then, sitting with that information, and then you can start looking for the resources that are available. And there are a lot of resources available. But I will admit that it's a very complex system that we're trying to uncomplex, but bureaucracy is fun.
To piggyback a little bit on that, I think I would just say that I would like for the culture to recognize caregiving as essential work, because it is. You don't have to go now.
Yeah. I wish that more people would attend support groups, because they're the people that they have similar situations, and you can speak with them and you may learn something new, because when you're a caregiver, you can't do everything. So you have to define, what can you do? How can you can't fix or cure dementia. You're not going to be able to do that. But how do you preserve that person's dignity? And, what else could you do? How can you make them comfortable and safe? I think you have to meet them where they are. And I think when you engage with others who are in the same situation, you learn a lot.
I agree with all of the above. I think the other piece is they say, be the change and make the difference yourself. My mother was recently hospitalized, and I don't like to ask for help a lot. And I stayed the night with her because she's a fall risk and she had confusion. And out of nowhere, someone I did not expect would do this showed up at the hospital, said, I'm not here to visit. She brought a canvas bag because, of course, this all transpired in the middle of the night. And I just, ambulance came and I raced there. And she brought a canvas bag with everything I would require for an overnight stay at the hospital. Bottles of water in a very dry environment, lip, chapstick, a small pillow, a phone charger, protein bars, an apple, a mandarin orange, socks, a toothbrush, toothpaste. I mean, literally. And I was so touched because here's someone that I would not have expected to do this. And I didn't want to bother my husband, who's a distance, and my 26-year-old son, who's living his life, and my father, who's starting with some changes, and who has to be with my brother at home. So just for someone, even maybe you are all taxed with caregiving, but if you can make a difference and reach out to someone who may not ask, but you think, you know what, I can do something nice for this person, it could make the difference. Even calling someone and checking on someone. Just little by little, we can make the difference in society.
So, to the point about bureaucracy that was made earlier, I think that there's a whole lot of these niche programs. We could probably talk for the rest of the night about the red tape and the barriers to entry and who qualifies for what based on what. I think in a better world, we are maybe thinking more about what families need instead of being so kind of myopic about what does this individual qualify for based on the nature of their disability and how long they've had it and how severe it is, and do they make too much money? I'm thinking we're burning a lot of resources, sort of chasing that around, and I don't think it's terribly efficient. And we lose sight of the fact that yes, we may have an identified patient here, right, who clearly needs support, needs caregivers. Probably there is a whole family system who is trying to function around that, and why can't we think more about that? So
I would say my wish would be for society to support families, caregivers in general. And being in early childhood, one of the biggest barriers we have is finding affordable childcare for children with special needs, or children in general. Let's start there. Yeah. But when you have even other factors going on, mental health issues, medical issues, it is a huge challenge in society. And so my wish would be for agencies to come together, federal government, whoever, to really improve that area so that caregivers can have a safe place for their kids to go, and they can get to work and do what they need to do to meet their needs.
Obviously tonight, a lot of the questions have been on the older population. But speaking for our littles, I think when parents are enrolling their children, if it's their first child, into school for the first time, there is a lot of self-doubt in that because your parenting is now on display, right? It's the first time that these kids are walking through the doors. But what I would like is for people to understand that there are ways that school can fit your unique child. And we don't expect every child to come in and fit an exact mold because they're all different and unique. And we really want to focus, like we said, on growing the families as strong as possible and providing free preschool to students so families can get back to work or go get a job or whatever it is that they need to do. Personally, my mother was a caregiver for many, many years. She had many brothers and sisters, but they moved out of state. And so she was the one kind of stuck behind to take care of everything. And I just, listening to all these conversations, it just makes me want to call her and just say, hey, you did such amazing things when you had the people here. And like you mentioned, she'll never regret the time that she spent with them. So I just want to make sure you guys know that it takes somebody really, really special to do the work that you're doing. And have conversations with people, be open and have dialogue, because there are so many of us that are going through those same things, and we need real human connection to keep moving forward. So I just want to commend you all for coming and sharing these stories. It's been lovely to hear. So thank you.
Annemarie, that was the perfect summation of tonight. Thank you so much for ending on that note. Please gather any resources you need. If you did want to ask a question of Dr. Hardy, I can give you my card and get an email sent to him. But please, I am so in awe of all of you for coming here tonight, taking time out of your very busy schedules. You're caregivers yourself. It's a big ask, but thank you so much for coming and talking with our patrons and providing resources and doing the work you do every day. Thank you.
Thank you.